Wash your hands and make sure that you wear a mask if you're sick. I'll be going over what it's like to work in healthcare with a coronavirus outbreak.
Okay, so basically, right now
In the US, we have this outbreak of the coronavirus, and then it's spreading all over the world. It's determined to be a pandemic, so a worldwide issue. Or the virus that you're hearing about a lot right now is the coronavirus or mutation COVID-19. So COVID-19 is a certain strain of the coronavirus. This particular virus, we currently don't have anything to treat it. The current recommendation is if you get it, start it today. In mid-March is to just make sure that you wash your hands, cover your face with a mask if you're coughing or you're sick, to social isolate, and then also to just drink plenty of fluids. And then we just, as far as what I know, is that you treat this virus symptomatically. So there are things that scientists are looking into in order to treat the coronavirus, but currently we have no cure for it. So basically, during a pandemic, this is my first time going through a pandemic like this. I would say for sure it's very different and unexpected. I would say overall I was not prepared for the pandemic. I like to be prepared. If you know me, I'm a person that I like to prepare before like everything, and I like to have everything ready, like even being a Floridian for hurricane season and whatnot. But for this pandemic, I was completely unprepared for this. I would say that we are okay on supplies and stuff that we need. However, just like overall, like the experience of like the empty, just the experience, and then the mass fear for this was just different, and hearing it on the news every day is not fun. But overall, working in healthcare, I currently work at a dermatology office, which is definitely, it's healthcare, so I'm one of those workers that are required to work, because we definitely deal with a lot of patients that need essential surgeries and essential procedures. It is not on the front line, so I would not say that. I'm definitely not on the front lines. I would not call myself a front line. Front line would be like a primary care or people that are in the emergency room dealing with COVID-19 patients all the time. I would say though, by working in healthcare, I definitely have noticed a shift. I noticed a lot of patients, though they have like a scared look on their face when they come in for their appointment. They just expect us to cancel or to get rid of their appointment or whatnot. I've had patients that don't want to sit in the waiting room, which is understood because the coronavirus is currently known to be something that if someone coughs in a waiting room and then you're in there long enough, you could possibly catch the coronavirus. So it is something that is known. If you're close to another person that has the coronavirus, it's something that you can definitely catch by being nearby them. I've had patients that now, like, as soon as you see them or they wash their hands multiple times or you hear running water while you're outside of their room. I mean, that's become more common now. Now the elbow handshake has become more common now, so no longer greeting patients by shaking their hands, and that's something that's definitely new. And then also, overall, if you're walking around in scrubs, like from my experience, going to the grocery store, going anywhere, walking around in scrubs, like, or even the restaurants, like, people do tend to think or tend to assume that if you're in healthcare, you're definitely in the front lines, which we do deal with patients, so we are, as healthcare professionals, we are more at risk. However, they, become more like kind of like fearful. I guess they don't want to like get too close to you too with the scrubs on because they feel like, oh, it's a possibility that you might have it on you or something like that. And then I think that also the hard part is like you don't know who is a carrier right now. So someone could be a carrier and look perfectly healthy. So I just definitely think through this entire experience, it's important to follow the CDC's guidelines. Don't listen to all the fake news out there when it comes to like Facebook stories and whatnot. Just try to listen to the people that are over you, like your mayors and your elected officials, the CDC, and just follow their guidelines. try to not be too weary about some of the other sources. Just stick to those main sources. I would say that's what I'm doing. I'm definitely watching the news and then following what's going on with the CDC and what they recommend. I'm definitely, as a healthcare professional, one thing that's changed about the way that we work, we start washing our hands a lot more, using hand sanitizer a lot more, sanitizing the rooms a lot more, sanitizing door handles, wearing masks, and then even canceling some patients' appointments that they have, like if they're experiencing like a cough or any other symptoms, a dry cough or their recent travel, we recommend that you cancel your appointment. So we're calling and letting them know that, and then also before we call them back, we can also ask them that question as well, because we have to do our best to like protect ourselves. So we don't want to get the coronavirus and then be out, because then who's gonna be helping with skin surgery cancers or something like that? Who's going to be helping with skin surgeries? Then you won't have anyone. So it's definitely important to stay healthy, and you have to keep yourself healthy in these type of situations and take extra precautions. So that's basically what we're doing and what I'm doing, and then hopefully everything turns out a little bit better. I know it's been like a tough situation in general. The social distancing is not fun, but I'm trying to find things to do as of now. So it's not been fun, but I believe that we'll get through it together. Just follow the recommendations so we can be on the right track and we don't have to worry about stuff like this in the future, or we can try to prevent the spreading of this disease. Alright, so thank you for listening to my video. So if you want more videos like this, or are you interested in more videos, I'll be going over more pre-PA advice and how to get into PA school and whatnot. And then also I'll be going over some different things as well, some things that are, you know, unique. I won't be just going over that type of stuff. So if you feel free to, you can go ahead and subscribe. We'll see you next time, and stay safe.